Stress, migraines, we are all feeling the impact of COVID-19. To help relieve the pain, some are turning to craniosacral therapy. To explain more, let's bring in licensed occupational therapist Magda Giro with us here on the MegaCast. Thank you so much for being with us.
Sure.
Okay, explain to us exactly what is craniosacral therapy.
Yeah, it's a type of therapy that really works with the fascia of the body. And the fascia is like, the easiest way to explain it is like the saran wrap that wraps all the muscles, all the organs through the whole body. And like saran wrap, when saran wrap is nice and smooth, it covers our stuff and holds our stuff in our bowls. When it's nice and smooth, the fascia is nice and smooth in the body, it works and functions well as our shock absorber. However, things happen in life, right? We're in accidents, there are birth issues, and that fascia becomes crinkled. What craniosacral does, it applies 2 grams of pressure on the muscle, and it goes right into the fascia and is able to distinguish where there are restrictions. So the simplest way people see restrictions is that it limits to how far an arm moves, how far how far legs or hips moves. I work and specialize with women in pelvic, and I also specialize working with children. And with children, it can impact how they eat, how they breastfeed, how they use the muscles of the lips, the tongue, the jaw, how they even acquire the developmental positions they need to acquire, like prone on elbows, crawling, those kind of things. It also impacts children with sensory integration issues and autism. If there's crinkles the children aren't able to process and learn and focus and pay attention, it can cause anxiety in people. And it really brings people to a place where their performance is limited. And I see that really my job is to take their path forward and get them into whatever it is they're committed to and they're destined to do, because their body is fully functioning.
Some people believe that this is an alternative medicine. What do you say to those people and why you believe it works?
I believe it works because there's a significant amount of research behind it, but also in my practice, I have seen people make gains that they haven't been able to make gains before. I have seen children who have restrictions in their occipital base, not be able to focus in school and go from being D students to being, A students, and coming in and telling me they got 100%. And for me, that people can, children can go from being D and E students to getting 100% because I released a restriction at the base of their neck. That for me is invaluable. Or if, like I have worked with senior citizens who had breast cancer and there was restriction and scar tissue from surgeries that they had. And as I released the restrictions there where they couldn't lift their arms to take something off a shelf, now they can lift their arms and pull things off the shelf. And that changes the quality of people's life. If they can do things independently, and can you imagine if you can't reach for a bowl when you're cooking, you have to ask somebody, and now that you don't have a restriction, you can reach and grab a bowl at the top of your counter cabinet. That makes a huge difference.
Yeah, I will say, frozen shoulder syndrome like years ago, and I remember not even being able to wash my hair. It was so painful. It was crazy to go through that, but I use physical therapy. And so what is the difference between what you're doing and a physical therapy session as well?
Yeah, so my approach really works with 2 grams of pressure. Where physical therapy is a lot of exercise and strenuous work. And, physical therapy, traditional physical therapy works phenomenally. But craniosacral speeds up the process in which people gain their progress. And it's less invasive and it's less painful, so that people get the results that they are looking for in a shorter amount of time. So it won't take as long to get to where they want to go to.
And so this is done over what, several sessions?
It is. And it really depends. Every person is individual. It really depends how much restriction is in, how many muscle groups is being affected, how many, if it's the whole body that, if somebody's in an automobile accident, it could be like restrictions through their whole body because, that was such a severe blow. And for some people, it may be really short. It could be anywhere from, 1 or 2 sessions to like there are people with a lot of restrictions that it can be like a 6-month kind of thing that we would work with. And then I also do other things to supplement if I'm working with kids, because kids have a lot of other things that'll be impaired. So I use my occupational therapy skills to bring a holistic view to what's possible for kids and adults.
Magda Giro with us here on the MegaCast. She is with the Michigan Craniosacral Therapy. And when would a parent know to take their child to you versus a regular doctor?
Well, you always want to start with your physician first, right? Because that's the head of your medical practice. And then doctors will refer people to occupational therapy and physical therapy. And then some kids get referred, like I have seen kids as young as 10 days old, where they've been referred because of difficulty with feeding off the breast and bottle feeding and failure to thrive. So it's usually, when a doctor sees that a function isn't happening, they will refer to me. And doctors will contact me and ask me, this is what I need done. And I will do a full evaluation and look at all, and then I systematically will hit the places that there's restrictions so that the person can get back to the life. And for me, it's getting people back into the life as fast as I can.
So I was watching videos this morning on the entire procedure, and it's similar to a massage in a way, but it looked like it was such a light touch.
It is. It's very light. So if you placed a penny on your finger and balanced the weight of the penny on your finger, that's how light the touch is. And so it's very, a penny weighs nothing. So it's very light. So what you see is a decrease for people in feeling pain. Sometimes people have so much pain. When you have that kind of light touch, you aren't going to get the severe pain, and as you work on people, the pain gradually goes away, and people can move without any restrictions, raising their arm to grab things or brushing their hair and things like that.
This really is fascinating to me. So are you seeing more and more people right now because of the pandemic?
I am. Because we're removed and I'm in a small office, and people don't have to go into the general hospitals, more people are coming for this kind of therapy because it's providing resolution. And I'm even getting people who have had COVID, and you see the effects that it's done on their bodies and the restrictions it's caused in their breathing. I've worked with people where they can't even take a full breath because of COVID and the restrictions in their lungs. I worked with people who, because of COVID, their thinking process is slow, and it's just frustrating. And as we work on those restrictions in the fascia, in the brain, and in the lungs, people are thinking faster and going back to how they used to be before COVID.
I know that some insurance companies are starting to open up to more of these alternative therapies, but they're still not there quite yet. Is this covered under insurance or no for most people?
If you just do a craniosacral therapy only, it is not covered. What you do is like a modality, if you go to physical therapy, they do hot packs as a modality, and they do stretches, and that's a modality. If you just use it as modality and complement it with regular occupational therapy activities, then it is covered.
How'd you get involved in this?
I am always really curious about learning, and I stumbled on a class, and I went to the class, And I was able to figure out what was happening in the tissue. And I'm like, gosh, this can't be that I can figure this out. And then I just kept working on it. And then I had the blessing and fortunate ability to adopt my son. And when I went to Guatemala to pick up my son, what I got faced with is a child who had torticollis, who wasn't eating correctly, who wasn't. And my son has been my inspiration to really keep progressing. I'm actually trained and certified at a diplomat level, which is the highest level you can be certified in this. But it was from my son, and always wanting to know, like, how do I make my son better? How do I get his skills to excel? And my son is now 16 years old, and he, plays football, and he's a straight A student. And, to see the success that he is able to do it by using this is just phenomenal. And I just want to pass that on to people and really have kids have that success, and women, and whoever wants to have the success in their life, to do what they're meant to do and not be stopped.
So who should seek this type of therapy?
Yeah, so anytime you have, if we begin with children with breastfeeding issues, children with feeding issues, children with sensory issues, tongue tie, people who have had some kind of automobile accident, have some kind of injury where they have pain. It does work and help children people with anxiety. So it really has a wide encompassing range of what it can provide.
This is again, I'm just fascinated by this. Especially, we want to invite people to go online and Google and watch the video, because it seems like, how is it something that comes across in the videos is simplistic, can help so much in such a wide range of issues, but there is a science behind it.
Completely. Like when it was first being developed by Dr. Upledger, he was a professor at Michigan State University, and they actually invited a chemist to hook people up to electrodes to see how it was changing. And what they noticed, it just kept changing the muscles, and it kept changing the whole landscape of the body and how the body was working through that technology. And since then, there's been hundreds and hundreds of things done in research at Upledger Institute in Florida continues to do the research. And this technique actually has people trained all over the world. Like, it's in Russia, it's in Brazil, it's in Scotland, it's all over the world. And the commitment is really to give this to more people out there.
So you are an occupational therapist. How did you come to merge the two worlds and to really grasp and take hold of the holistic world of the medical field?
Yeah, it was hard because as an occupational therapist, I was trained in tradition. And like when I first started, it was not accepted by the employers that I was working with. And what really sold me on it was the progress I made with my son. And then as I transferred that to my patients and started working with them and seeing how fast my patients made progress using craniosacral is what sold me. Because, if people can make progress, their lives change.
And do you think, though, that we're starting to talk more about some of these holistic and alternative medicines out there, that this is going to open up your world even more?
I do. I think that people are really getting knowledgeable about, traditional medicine and holistic medicine. And as they learn about holistic medicine, there are benefits. There are benefits in holistic and traditional, but I think it's the balance of both that will really bring people forward if we use both of them to, the knowledge of both Western and Eastern to really bring things forward.
Right, and well, as we've been talking too about the vaccine, so many people right now are hesitant about some of the things that we're putting into our bodies. And one thing I think during COVID is, especially when we had that breakdown in the food supply chain, was people are starting to pay more attention to the food and some of the things that we put in our bodies. But we are still Americans, and we want that one quick, fast pill. Let's take a pill and move on with our life and everything is good. But sometimes the answer is just getting back to the basics then.
It really is. You know, like if we really take a look at how we treat our bodies, our bodies are wise. They know where things are hurting and where we need to address. But as Americans, we are so fast paced that we ignore our body signs that, you know, we need to work on our shoulders or we need to work on our hips. We ignore it until it becomes something very severe, where all of a sudden there's so much pain that we can't walk, or we're stuck in bed because our back hurts so bad. That's when we go, oh, maybe I should do it. And then what you see is, you know, people, especially with adults will come in and do 1 or 2 sessions, go, oh, okay, I feel good. I know I'm not done, but I feel good, and I got to get back out there running.
Like with
Really,
like with any kind of therapy, whether it be occupational therapy, physical therapy, psychological therapy, there's no one-size-fits-all solution or method to treatment. So when somebody comes in, because you are interacting with people and treating people of all different ages and all different ailments, what is the process that you go through to understand what they're suffering from, and how does that impact the way that you approach treating them with craniosacral therapy?
So the process, I do a whole body evaluation, and I take a look. And then craniosacral works on a lot of things, but there's also being knowledgeable and wise to know the limitations of craniosacral and what it can't address. So when I do an evaluation, I address with people, this is what craniosacral can work on, and this is how I can impact, and this is the difference that I can make. And if I do an evaluation and they don't have restrictions in their body and it's something else, then I refer to the appropriate person that they should see. You know, I provide them with a list of doctors or, you know, whatever it is that they need. Because there are things that obviously, like, you know, you can't go to a cardiologist and expect him to work on your foot. It's, you know, that's not his knowledge base, and that's not what he's supposed to. So it's really knowing the balance again of what my type of therapy can do and what's out there, and being knowledgeable to refer people to what they need, or, you know, getting them complete with what I can provide them.
Well, every person is different, every body is different, and you know, an individual needs to explore what could work for them. With the Magda, how can people find out more about what you do and how to reach you?
If you go to my website, which is www.michigancraniosacral.com, they can read all about what I do. You can give me, you can also call me, and I'll take the time to explain and really go through things with you. And then my number is 248-318-7912. And for me, you know, the first initial call is really about educating you and seeing if I'm the right fit for you. And then, you know, like exploring what is possible and going from there.
Well, it is fascinating type of therapy, but it seems like it is also helping a lot of people. And so we appreciate you coming on and educating us about it.
Absolutely. Thank you for having me here.